little bit about today's session. We're going to be talking about ISO 45003 and about workplace wellbeing, sitting within the remit of health and safety or occupational health, and you know, kind of the reasons why that kind of makes sense. So in terms of who BMR is, we're basically an organisation that takes works with people and businesses to look at taking a really kind of systematic and data-driven approach to workplace wellbeing. There's a lot of fluff around workplace wellbeing. There's a lot of kind of very soft approaches, and we tend to approach workplace wellbeing differently than when we approach other things in the workplace like continuous improvement and quality. And there doesn't really need to be as soft an approach as we tend to take. You know, there's a lot of focus on trying to fix employees and magicking away employee stress, but you can't get rid of employee stress by focusing on the employees, because 9 times out of 10, the employees are not the problem, okay? The problem is the work environment or the design of work. That's often the issue when it comes to stress in the workplace. So, you know, stress is just a symptom of what's going on in the workplace. So what we really need to do is to get to the root cause within the work environment that's causing the stress to occur, okay? And that's kind of what, that is what we help you to do, okay? So in terms of today's discussion points, we're going to be looking at the statutory legal requirements for workplace mental health in the UK, because there is a lot of legislation that exists that says, as employers, we have to be doing these, meeting these statutory legal demands, okay? Then I'm just going to touch lightly on some of the cases, some of the consequences for businesses who fail to do that, okay? Then we're just going to touch on some stats around the size of the problem and the impact of COVID and what really is an integrated approach to workplace wellbeing. We'll talk about the new standard. Is anybody familiar with ISO 45000?
Yeah, I can't get out of the kitchen.
Oh, could you, whoever that is, could you mute, please? You'll just check you're on mute. Thank you. Yes, so is anybody on here familiar with ISO 45003? Well, anyway, as we go through, we'll talk about 45003, we'll talk about psychological risk and hazard, and we'll look at how we can actually get well-being as a measurable KPI, okay, in terms of return on investment and benefits to the business. So if we look at the UK health and safety legal framework, okay, most of this sits in the Health and Safety at Work Act, okay? The Health and Safety at Work Act, Section 2, tells us what we have to do. And what we have to do is to ensure, yeah, that so far as it's reasonably practicable, that we look after the health, the safety, and the welfare of all employees, okay? So the law is very clear, okay? Now you could say, well, it doesn't say mental health, it doesn't say psychological health. It's covered under health and it's covered under welfare, okay? And I'll talk to you, just to give you a couple of examples of case law in a second as we come on to that. So the law is clear, we have a duty of care as an employer, and that extends to psychiatric health. The way that we are to do that is advised in the is in law in the regulations, in the 1999 regulations. That is how we have to do it. Regulations 3, regulations 5, we do that through carrying out risk assessment. So in the same way that you do for physical safety, you have to apply the same principles for psychological safety. Yeah, it's the same risk management approach, okay? Absolutely the same risk management approach, a different set of potential risk factors, okay? That's all we're doing. We're taking the same methodologies, we're applying the health and safety risk management principles in exactly the same way. We're looking at a different set of hazards and potentially a different set of engineers to come up with a solution, okay? That's all it is. And then what we've got under this is things like the best practice guides and international standards, okay? So back in 2004, Health and Safety Executive released the UK's stress management standards, okay? Those stress management standards look at kind of 6 key areas of work design, not people, work design, yeah? Workloads, autonomy. We'll come on to them all in a little bit more detail as we go through. You know, support, relationships, all of those factors are covered in the UK Health and Safety Executive Stress Management Standards. And those stress management standards have now been used in accordance with other standards across the globe to build up the new international standard, the new ISO standard for managing psychological health and safety at work in terms of psychosocial risk, okay? So this standard's been in work for the last probably 3 to 4 years now. It's been agreed across a number of different countries, and again, I'll go on that into that in more detail. But this really gets down into the nitty-gritty of giving you the tools and the framework, well, giving you the framework of how you do that. I'll come on to some of the tools that you can use to support that as we go through. So, you know, we've got this in the Health and Safety at Work Act here, but mental health and wellbeing in the workplace is covered in a number of other different legal acts. So the Equality Act 2010 has got mental health in it. The Protection from Harassment Act, that, you know, that offers protection to employees in cases of bullying, okay, in the workplace. And then you've got, you know, even more serious cases serious case law in terms of corporate homicide, okay? I don't know, and it might be worth you having a Google. In France, a number of years ago, one of the telecoms companies wanted to get rid of a bunch of employees in terms of restructuring. Very difficult to do in France to get rid of civil servants, apparently. And so they started with a campaign of bullying and harassment across all employees, making work really, really difficult for them. What happened in France was 35 people, or around that number, that worked for that organisation took their own lives as a result of that bullying. The directors of the organisation were held accountable in terms of corporate manslaughter, and they were jailed, okay? So there is a lot of responsibility on employers to take this seriously. It's not a perk, it's not a benefit, it's not a nice to have, it's not something that you're being kind in doing. It's a fundamental way of doing business and the way in which you should be treating employees, okay? So just to put it into context in terms of some of the case law, okay, the case law that really set the precedent on this was Walker versus Northumberland County Council. And this set the precedent that there is a duty of care to provide a safe system of work, and that extends to psychological injury, okay? So this Mr. Walker was a social worker, and he was employed by the council, had a really heavy and emotionally demanding caseload, and he had a mental breakdown, right? Then he came back to work. Nothing had changed. He kept asking and asking and asking, yeah, for assistance, okay? But he was given no additional support. So guess what? He had a second breakdown, okay? After the second breakdown, his employer then chose to dismiss him due to ill health, okay? And he basically took this to court and brought an action against his employer and won, yeah, and established this precedent that they did have a duty of care to ensure that he had a manageable workload, yeah. And there's other case law, there's a couple in here, and you can kind of research them kind of outside of today's webinar, but interesting reading. Barber v Somerset approves 16 principles that kind of need to be kind of followed in terms of determining employers' liability. Some of those key ones are A, the employer must be in breach of the act, which in Walker v Northumberland they were. It must prove psychiatric injury caused by the breach, again in Northumberland, v. Walker it was, and it must have been reasonably foreseeable on the part of the employer. Again, the second breakdown in Walker v. Northumberland was reasonably foreseeable. If he'd already gone off once ill because of the workload, and then nothing was done to change that, it's going to happen again. It's very high probability, okay? So it was reasonably foreseeable, okay? So that's kind of around that element of the law. And again, in terms of other case law, Protection from Harassment Act, Majowski versus St. Thomas's Hospital, Majowski claimed he'd been bullied, okay, by his manager, and the employer was held vicariously liable for damages under Section 3 of the Act, okay, for a course of conduct by one of his employees that amounted to harassment, okay. Same again in Helen Green versus Deutsche Bank. This was quite a recent case. This was back in, I can't remember exactly, but sometime in the 2000s. And again, similar thing. And in this case, it was quite a high profile case. Helen Green was awarded £800,000 under the Protection from Harassment Act for future loss of earnings. It's a massive award, and a further £35,000 for psychiatric injuries. So, you know, in summary, there is no getting away from the law, okay? And I think coming out, and this is my opinion, coming out of a post-COVID, you know, coming out of this COVID pandemic, coming back into this workplace, this duty of care, especially around psychiatric health, is never been more important. And employees are now so much more focused on this work-life balance, and, you know, being able to work with autonomy, being able to have, you know, that freedom to do the job when they need to do it. So the whole way that work is designed, you know, and the way that we go to work and the way that we carry out our jobs has changed hugely in a short period of time. And if we don't take this time now, when there is so much change, when there's that perfect kind of ingredients for change, when everybody's more open to it and more flexible given what we've achieved over the last while, when is that ever going to be? Yeah. So if we look at the size of the problem in the UK, it's massive. It's absolutely massive. Okay. So I've brought a lot of these figures from the Deloitte report. You can go on the internet, you can find stats after stats after stats, okay, on mental health. For me, I've stuck with the Deloitte report, and everybody will always have arguments about there being flaws in the research or the reporting, but let's just taking it kind of collectively, these figures show, doesn't matter where you look, it's a big problem, and it's costing business and costing people, health and finance, okay? So size of the problem in the UK, Deloitte estimate around about 42 to 45 billion pounds. Yeah, and that's broken down, if you see on the right here, in terms of, you know, actual costs we can measure, absence, yeah, sickness, turnover costs, we can actually measure that, you know, we can get that out of the kind of company accounts. The one that's a lot more difficult to measure here is this presenteeism cost. I'm here, but I'm not really being productive. And I think a lot of employers historically, and even through COVID, I hear some real horror stories associate being present with being productive. So I hear stories of people that are working for organisations where they have to have their Zoom on from 9 in the morning till 5 at night, so that their employers know that they're sat at the desk and they're not putting the washing in or feeding the kids or taking the dog for a walk. Okay, so there's some horror stories of the way organisations have behaved, and then there's some really positive stories of the way organisations have adapted to be flexible with staff. But, you know, if I'm sat at my computer all day because I'm being forced to sit there, am I going to be as productive as I would be given a bit more autonomy? So this presenteeism cost is a really difficult one to quantify, and it's, you know, a lot of people that you speak to would say that that's probably underestimated as a number. Breaking it down further, Deloitte's calculated that the average cost of an employee per year is £1,700. And in the financing and banking worlds, insurance worlds, kind of the city cost for that is about 3,400. It's about double, okay? But well-being investment, the return on that investment has huge dividends, okay? Yes, it's as low as 2 to 1. Average is about 5 to 1. It's been as high as 9 to 1. I think, again, moving forward, coming out of COVID. That is going to be even higher. And, you know, when we're talking about investing in well-being, we're not talking just fruit bowls and yogurt. That's and mental health first aid training. It's not enough, okay? Because we've got a huge problem in terms of mental health. One person every 2 minutes takes their life, okay, by suicide. Last year, period from March to December, we were in a global pandemic. 1.3 million people died of COVID, okay? In the period from January to December 2020, over 1 million people died by suicide globally, So it's a problem. It's a huge problem. And mental health is probably one of the most under-resourced areas in terms of healthcare. So, as an employer, not only do we have this legal responsibility, but we have a moral responsibility, and we have it for the productivity and the success of our own businesses, that we need to look after our people. We look after them, they will look after us. The loyalty will be there, okay? So again, just these are numbers from the Health and Safety Executive. This goes back for the period ending from 2017, period ending March 2019. I can get my teeth in. 602,000 people off work with work-related stress. 212.8 million working days lost, right? So massive, massive numbers. Move forward a year later, so March 2020, pre-pandemic, 828,000 people suffering work-related stress or depression, 17.9 million working days lost to mental health. Again, pre-pandemic. Look at the rise in those numbers, okay? Yet, what we continue to do is what we've been doing for the last 5 years. Let's train mental health first aid. Let's send people on mental health training courses. Let's focus on individuals. Let's focus on stress. Let's focus on managing individuals and teaching them to be more resilient. It's not working, okay? It's not working. We can't keep focusing on the people. As I said before, they're not the issue, okay? It's the work design that needs to have the focus on it. And actually, when the Health and Safety Executive first released the stress management standards in 2004, that was the one time when it was shifted from the individual to the organisation that these numbers came down. However, what we continue to do is to hammer home, doing the same thing. Was it Einstein who said definition of doing the same thing over and over again and expected a different result? This is what we focus on as workplace mental health. This is how it started. And don't get me wrong, right? We look at all of these things and we can help support organisations to introduce all of these things in the workplace. And these are great initiatives. Yes, let's get some first aiders in place. We need signposting, we need support. Let's have employee assistance programs. They cost peanuts, okay? They cost peanuts. They give support to your employees and their immediate family for less than 4 or 5, depending on your organisation, £5 an employee per year, okay? Gives them 24/7, 365-day access to support. So brilliant, great things to have. Exercise classes, nutrition workshops, fruit bowls, all really good stuff for keeping us well. Meditation, mindfulness, yoga classes, wellness apps, it's all brilliant. But you know what? Is any of that meeting your duty of care as an employer to manage psychiatric illness? Where's the risk assessment? The law states you have to do one thing. You have to look at the factors in the workplace that are contributing to the potential for psychological ill health, okay? None of those 3 areas do that. So what we need to do is to look at taking an extended approach, okay? And we need to build on what's been done already, okay? So we need to take this extended approach and looking at addressing the design of work and not just the people. So to kind of put that into context, what I mean by that, if I've got somebody who's working in a warehouse and they're packing boxes, I wouldn't go up to them, you wouldn't go to them as an employer and go, there you go, here's a gym membership. You've got to lift heavy boxes Some of them have got 60, 70 kilos in. Is a kind of your objective is to kind of learn how to, the outcome I want from giving you this gym pass is that you can lift 60 kilos. We wouldn't do it. Yeah. We have manual handling in place. We have guidance, no more than 20, 30 kilos in a box. The point I'm trying to get over is that we ensure that there is a safe system of work to protect the employees from potential injury. Because we know that if you don't use the correct lifting techniques, if we try to lift boxes that are too heavy, you're going to have an injury. So why do we take a different approach to workplace psychological health? Why are we not looking at what in the work design, what in the way that we're doing work is causing the stress to occur? Okay, so that could be something as simple as, we've brought in a new computer system. Yeah, and stress in the workplace is like stress in life. It moves up and down. So it's pretty context, we brought in a new computer system. Yeah, we didn't bring it in very well. Change management wasn't done very well. People don't feel comfortable in using the system. So actually everything's backing up because they're getting the data entry wrong. So actually, we haven't got a person problem in the business. Teaching those people to be more resilient to stress or to work longer hours, just going to add more fuel to the fire. What we need to do is identify that actually we've got a training issue. We've got a skills gap. We need to upskill those people. Yeah. Sort the problem out around the IT issue, i.e. the work design, and the stress risk factor goes away. Okay. Same approach, different risk factors. Okay. So it's about creating safe systems of work and about creating good, safe, efficient work design so that employees can get the jobs done. Because nobody turns up to work to have a bad day. Nobody turns up to work to walk in feeling great and to walk out feeling like they've been through the ringer, okay? We don't want to feel like we've been in a washing machine and come out thinking, what happened to me today? I'm so drained. So when we're looking at an integrated approach to workplace mental health, what we need to be doing is to look at and this is from the National Standard of Canada's psychological health, and Canada do psychological health really well. And what they look to do is a place that promotes well-being, okay, and actively works to prevent harm, okay? So if we look at this graphic here, what we've got on the top is the mental health continuum, okay? And this applies to everybody, yeah, in the same way that it would be with physical health. So, if we look at the flourishing element, this is where we're absolutely firing on all cylinders, highly motivated, on it, winning at life. If I equate that to a physical equivalent, I'm triathlon ready, yeah, from a mental health perspective. Yeah, I'm absolutely winning at it. We'll occasionally be in there where we're really at that optimal level of well-being. For the majority of the time, we'll exist in mental wellness, okay? The mental wellness, I'm up, I'm motivated, I'm going to work, I'm doing what I need to do, I'm getting through life, I'm functioning well. And then every now and then, boom, life throws as a curveball, yeah? Your dog dies, a family member dies, COVID hits, there's a divorce, there's a separation, there's something, some life event that knocks us off kilter, okay? So again, the physical equivalent of that for me is having a cold or it's having a flu where we're not feeling 100% and we're knocked off our game for a little while, okay? And then what we tend to do is we will pull ourselves back into mental wellness, or left unchecked and left to get more, for that to kind of decline and become more of an issue and maybe, potentially slip into anxiety or depression, then we start to come into this mental disorder part of the continuum. So, and this is a concertina. I'm not saying this many people in that, everybody sits here and everyone sits there. This is a concertina for every individual, and every individual in your workplace will be somewhere on there to a greater or lesser degree. Yeah, they'll exist somewhere. So what we currently do with workplace mental health is we're really only focusing on all of this mitigating illness bit. Yeah. So if we're only focusing on that, where are we addressing the needs of others? Yeah. if we look at the promoting flourishing, we might do a little bit of health promotion, okay? So the fitness classes and what have you. But really, what are we doing around work design? What are we doing around strengths focus, you know? Do we look at the character strengths and the personality traits of the people that are working for us? If we understand the strengths of the people, if we can make the work play to those individual people and team members' strengths, we're going to create better results. We're going to create better relationships, because if people do more of what they're naturally good at, they'll do more and more of it, okay? So when you kind of look at it and break it down quite simply, it really does make sense. And then it'll be interesting to kind of know, just even in the chat, how many people within their organisation carry out regular risk assessments and stress assessments and education for every single person in the organisation, not just for mental health first aiders, okay, on a regular basis, okay? Because this bit in the middle here, this is the legal bit, okay? This is the legal bit that a lot of us don't realise we need to be doing. And you might well think to yourself, well, yeah, actually, we are doing some of that. We have been doing risk assessments. We are doing wellbeing check-ins with our employees. But have you been doing that all the time? Is that systemic part of your business process? Where does it sit? Does it sit in health and safety? Does it sit in HR? Yes, it does. The ISO standard map would cover that, and we'll talk about that as we move forward. So, you know, we're not doing the one piece that we know makes a difference. We know because of the way the stats told us with the stress management standards introduction back in 2004. Focus on the work environment and not just the individual, then we'll start to see improvements, okay? So that takes us into the new ISO standard, okay? So when we're looking at the new ISO standard, this is very much a framework, okay? No silver bullet. Workplace wellbeing, workplace mental health, no silver bullets, okay? There are a bunch of tools and lots of different things that we need to pull together as pieces of a jigsaw, yeah, that fit your organisation, because every single organisation is different, yeah? So we're looking at psychological health and safety at work. Now, this is a completely voluntary standard, okay? It's not certifiable on its own as a standard. It's a child standard of 45,001, okay? In old money, that's 18,001 in terms of occupational health standards, okay? So it sits under occupational health, and that's been done specifically to put it under occupational health because it's within that framework. The standard, if anyone's familiar with 45,001, when you look at 45,003, it follows the exact same structure and the same format, okay? So 35,000 certificates, I believe, issued on 45,001 globally at the moment. Still a bunch of 18,001 people to transition over. The scope for this to be a huge game changer in terms of putting this shift onto kind of organisational responsibility is huge, but it needs to be done properly, okay? So as I say, voluntary standard, this has been agreed best practice, 74 countries, okay? So this isn't just, you know, somebody sat in a darkened room. There's been consultation with various countries, different cultures around this to come up with this framework, okay? It brings in, you know, in terms of you're looking at the UK legislation, it covers the recommendations from the Thriving at Work report, from the Stevenson Farmer report. It covers the mental health at work commitment checklist. It covers anything you'd find in best companies to work for checklists. It covers all of these different things. It covers the stress management standards. So all of these requirements are brought into this standard, okay? So, you know, there can be with this standard a real game changer to start seeing these numbers come down in the workplace and for us to start creating much more balanced work environments. And when I say balanced, a better work-life balance, but that doesn't need to mean decreased productivity. That can be increased productivity with a balanced, better work-life balance. So it's a win-win for everybody, okay? And, within the scope of ISO 45003, there are two areas of responsibility, employer and employee. It's not just down to the employer every time to make everything great for, for the employees. The employees have to play their part as well. They've got responsibilities when it comes to psychological health and safety. So, for the employer, it's about preventing harm, promoting flourishing and mitigating illness. And for the employee, it's actually contributing to that because, these initiatives, these standards, they won't work unless there's two key things happening. Leadership commitment, okay, it's got to come from the top. Otherwise, there's somebody we did a podcast yesterday with Louise Hoskin from IOSH, and she said, without that, it's like managing jelly, okay, which I thought was a very good way to describe it. So again, going back to the Canadian standard, ISO, prevent work-related psychological injury, actively promote well-being. And the third bit is within this occupational health and safety management system, okay? So it covers all of these different areas. So you're managing the risk with OH&S, using a risk-based approach. You need to understand the context of the organisation. You need leadership and worker participation. Without that, it will fall over, okay? Because if the leaders can't get the workers engaged, how are you going to understand how best to improve the work design? The experts on the work design, 80% of the time are going to be your workers. They're the ones doing the job, yeah? So you have to consult with them. Yeah, we need it documented. You need responsibilities defined. Do the risk assessment process. Do the competency. Make sure we've got that in for everybody. Get it into the framework of your business. It's in your management review. You've got some KPIs. It's part of your CSR. And then make sure that, you're not just, you can't dip in and dip out. It's like customer service excellence, yeah? Take it in the same context. This is kind of employee organizational well-being excellence is as important as your customer service excellence, yeah? Without customers, you have no business, yeah? And without employees, you have no business, yeah? You're going to always have employees, yeah? But you're going to have good ones, and motivated ones, or you're going to have like the downtrodden ones who really don't care. They're just there going, oh God, they're not really kind of living your business's values, okay? So within ISO, it's the same risk assessment for psychological hazards. Identify the primary risk factors that can lead to psychological hazards, okay? Learn how, understand how to kind of assess those risks, okay, and the potential impact of them, and then determine from that how we mitigate and control them, and then assess the effectiveness through consultation. It's a basic, plan, do, check, act, basic risk assessment processes, nothing more complicated than that. And, health and safety professionals have got the skills to do this. They don't have to be psychologists, okay? They really, really don't. So I'm just going to continue to the next slide. I'll pick up on with some of the chat topics as when we get to the end, okay? But again, I can see you guys are chatting amongst yourself as well, so that's great, okay? So when we're talking about psychological hazards or psychological risks in the workplace, these are the areas that we're looking at. These are the core principles of work that have the potential to become a hazard, okay, if they're not managed effectively, yeah? So if we've got huge workloads in the organisation and people are really struggling, if we don't do anything about that, like the Walker v Northumberland, yeah, it's going to become a problem. If we don't have the autonomy to do our jobs, especially in this type of environment, yeah, where you're managing kids and working from home and not having that disconnect, if we don't have the autonomy, we should be focused on the output, not the being present, as long as the output's there. And it's different in different organizations and different industries, I get that, but autonomy and having as much autonomy as we can to do those roles is really important. For some organisations and for some individuals, they may want a tighter level of, being managed, but it's about understanding that relative to your work environment. And again, clarity of role, support, relationship conflict, any of these things are potential kind of areas of risk. So you need to understand how people in your business feel about those particular areas of risk, okay? And the way that you do that is to consult with them, to ask, to carry out risk assessments, to carry out surveys. And that is where there are tools that are around that can help you to do that, okay? We work with a particular tool for a product called Flourish DX. Now, this tool is designed around 45,003, okay? So it's been in development alongside the standard, okay, for the last 4 years, okay? And although there is an app-based version of this, so that it's app-based and it's desktop, it is not a wellness app, okay? It's a diagnostics tool that happens to have also a front end for employees. Remember, I talked about shared responsibility before? So on the front end, there's a learning management system with lots of self-care tools around positive psychology for employees. There are signposting tools within that for employees to signpost them to EAP or different charities or different mental health first aid support within the organisation. And what the tool is designed to do is to enhance what you're currently doing, okay, and to really increase the consultation and the engagement piece with employees. And the way that it does that is through having different survey tools built in there. So we have specific survey tools around work design, okay? So the work design survey looks at those 8 factors here. It has a battery of questions across those different areas. We can customize surveys so that organizations can have these questions specific to their business, okay? And then what happens is, as we're doing these surveys, we have a live dashboard, okay? And this live dashboard is giving you information about the basically the thoughts and feelings of the organization. Do you feel wrung out and washed up at the end of the day? Do you feel that the organization leads by example when it comes to a work-life balance? Do you feel that would you use EAP or MHFA? It was within your business. All of this is de-identified data, okay? So it's all completely anonymized. And as I said before, there is no silver bullet solution, okay? This is a tool to help you to get to the most critical thing that we don't have at the moment in workplace mental health is data. Data about our business, data about the thoughts and feelings of our employees. And that data is good data because they're the ones that are telling you in an anonymized way, okay? So, yes, we can get the data, but then what do we do with it when we get it, okay? So what we're able to do is to identify the hazard in all of these different areas, okay? So we identify the risk by pushing out the survey. The surveys, you can do this and get the results back in a day or in a few hours, okay? So we push the survey out. The employees answer the questions. As they answer the questions, this live dashboard starts to populate with the different results. And what it does is it flags it into 3 different categories in each different work area. So it will score it out of 100. You will then look at those different areas. And what that allows you to do is very specific and very targeted areas that are causing potential concerns within the workplace, so that we're being very specific when we're looking at what we're doing here. And actually, this isn't always, again, this isn't about always focusing on the negative. This is what is the stuff that we're doing really well. Let's really celebrate some of the wins. But the point is, we do the survey, we get the feedback, we then understand the conversations that we need to have, okay? We've identified the kind of the areas of concern, and then what we do is we start to pull together basically our risk improvement plan, okay? So all of this is, risk assessment, yeah, risk assessment results, yeah, what do we do with the results, yeah, let's do a plan to start to then improve that, okay? And this is just one of the 4 survey tools that we have in there. So we then start to control this risk. We have a team. There is leadership commitment in this team. So there's, you know, there's different layers of the organization in here, because what we don't want to do is to get to this point and then they go, oh, well, we've got to wait 6 months to get it back up the chain to get approval to do it. We need people that can make decisions in this team, okay? So this team needs to involve a leader decision maker, people from management, and most importantly, the people that were involved in doing the survey, okay? Because that's where you're going to get your improvement from. That's where you're going to get the suggestions on what we need to do. And occasionally you might need to bring an organisational psychologist or another specific professional to help you to engineer some solutions to some of these things that may have been identified. The point is that we've done a risk assessment. We've come up with the areas of risk, we've discussed them, and we've come up with a plan with smart objectives and smart actions on there so that we can put this into place. And then what we need to do after that is going back to what we need to do is to review the effectiveness of it, okay? And again, we can conduct the survey again, either just on those specific risk factors for that specific same group of people, so you're comparing apples with apples. So it may be 6 months down the line when we've done our improvement activities that we go back and we conduct the same risk survey, okay? And then what we're able to do is to compare what happened in survey 1 to what happened in survey 2 with the areas that we identified as the ones that we needed for improvement. Did we achieve that? And if we didn't, why not? We go again. If it's still an issue, we didn't fix it, we go again. We don't have this, oh, we've got a problem, people are stressed, let's throw them on a resilience course, let's throw them on the first aid course. And then 2 years later go, wow, just lost 5 people on long-term sick because they're still stressed. Really? You expected that to change, go for a 2-day training course that just taught them that actually I am stressed? Before I just thought I was having a bad day, now I've recognised I've got depression. It doesn't make sense. So, you know, we need to have this data-driven way of kind of looking at it. So we're looking at the data based on people's thoughts and feelings. So this, as you can see, if you're doing it this way, it's got to be a continuous and systemic part of doing business, okay? And that kind of ties into like Kaizen. You know, workplace mental health isn't a quick fix. It's systemic, it's cultural, it's long-term. It's not going anywhere, okay? If you want to do it, don't dip in and dip out. Save your money, yeah? Not going to get you anywhere. Taking this approach where you're developing this culture where all employees are working together, step by step, bit by bit, you're creating long-term change that's going to become embedded in your culture, okay? So you're getting your employees involved. You know, this is just a basic kind of Kaizen circle of getting your employees involved, getting a list of your problems, encouraging your solutions and ideas, test it, check it. If it's successful, adopt it. If it's not, try again. You keep going and you keep going and you keep going, because our work environment changes all the time. Our technology changes all the time. And at that fast pace of change, we don't adapt as businesses and as organizations and as fluid kind of cultures and structures. We're not adapting with it. We're just working, you know, in some organizations, we're still working in the way we did in the 80s and the 90s, never mind the 2000s. We're just not evolving culturally as quick as technology is, okay? But the pandemic, COVID, has given us all a kick up the backside to say, actually, every time you said, no, we can't do that, COVID's just told you, yes, you can adapt. You just didn't want to before, or you didn't recognize the need to before. So what we can then also do within the platform, and I've only kind of shown you the few key highlights here, is that we've introduced something called the Flourish Factor. Okay, now what this Flourish Factor does is it starts to measure the actions that you've taken, okay? And it measures the maturity of your organization's psychological health and safety management system against the requirements of, against the framework of the ISO standard, okay? So what it does is it then, you know, this top bit here gives you a pretty graph with, you know, how many points you've achieved. Down here, the psychological health and safety actions, there's about 25 steps here, okay? And these steps are in a chronological order and logical in terms of the way that the standards set out. So this is what you need to do it, and these are the steps you need to take. So you're not kind of rushing off to do a survey when you've not got all the other kind of pieces of the jigsaw in place. So this is like, you know, you do your jigsaw, you put your corners in, you put the outsides on, and away we go. So it takes you very much in that approach. And then it breaks it down on, I'm using my hands and you can't see me pointing over here. It breaks it down here in terms of the ISO element and where you're meeting that. So as you go into each element of, okay, what do I need to do in terms of understanding the organisation and its context to score 20 points on here, yeah? What I need to do, and that's not necessarily, I've done a different one, I've done the leadership and commitment one, number 2. You know, do top management, lead the management, do the lead on psychosocial risk, yeah? What element of the standard is being addressed, okay? And then what's the action plan? What do I need to be doing to be able to do that? Once I've done those steps, yeah? And you don't necessarily have to do all of, exactly all of them, but you need to kind of get, you know, what's relevant in here to your organisation. So you need this risk plan. You need the risk and wellbeing communications plan, yeah? Demonstrating your commitment. So who's going to be responsible for psychological risk management? How are we going to identify what resources are needed? Are we going to update our plans and our internal systems? Who's responsible for reporting what to whom? How are the workers reported it? All of this is done, but we can do all of this within the tool, because we've got all the tools to support within the platform to be able to do this. So then as you're kind of going through that and you're implementing it, you know, it's not just, oh, I did it, I wrote a document and that's it, we've put it on paper. This is about truly embedding it, okay? So it's not an overnight thing. You can't just dip in and you can't just dip out. But as we do this, it takes us through step by step what we need to be doing. So, you know, we've got these tools, we've got the surveys, we've got the data analytics, and we've got the character strength surveys, we've got the work environment surveys, we've got the health promotion surveys, how are people doing on the pillars of positive psychology. We can do wellbeing check-ins with employees. All of these are really quick and simple. Gives us all the risk management tools that we need. We have specific line manager training, okay, on managing psychological hazard, how to do return to work. What are your responsibilities as a manager in terms of psychological health? Because do we cover that in management training? Not all organisations do. Some do, okay, some don't. And then from an employee's perspective, they've got a front end, looks like a wellness app, but it gives them access to some stress reduction stuff, some wellbeing check-ins. For me, the important bit on here is the mental health education. Everybody that's got access to the app, which is everybody in your organisation, has access to all the training. So as an employer, you can either leave them to get on with it, or actually you can bed this into your internal training program. So like we need to do manual handling, we need to do first aid. We can also say we need to do at least mental health awareness. You don't have to use all 30 or 40 videos, but some of them you'd need to make kind of mandatory, in my opinion. Just some of the basics. What is mental health? What is psychological health and safety? And line manager training would need to be, for me, included in all of that. So once we're starting to embed all this in, we can look at, you know, let's get some measures, you know, let's make a business case for this. So, you know, how do we measure workplace well-being? Is anybody who's doing workplace well-being measuring it? And what are you actually measuring? So, you know, for me, again, 3 of the key things that we've got, and let's not just measure negatives as well, okay? Let's measure the stuff, because also within the platform, we measure transformational leadership, high quality work connections, all of the stuff that we do in the business that promotes flourishing, because we want to focus on okay, these are scored really high. Why is that? Let's do more of the good stuff. These are scored relatively low. Let's do less of that. What do we need to make it transformational? So when we're looking at cultural KPIs, intention to quit, if somebody could say anonymously, what's your, I would kind of quit today if I had another job to go to. Yeah. Would you want to know that as a culture in your organization? Often we have a disconnect between what leaders think and what employees think. So ask them, don't assume you know what they're thinking. Yeah. Because you're not Mystic Meg. Doesn't matter how good you are as a CEO. Yeah. You're not Mystic Meg. So there's often a disconnect between what the senior leadership think and what the people on the ground think. And sometimes, and also the ones in the middle layers. So let's just get the data. What's the intention to quit? How many people feel they're at risk of burnout? Again, doesn't matter whether you think that, oh, well, technically, they're not really at the risk of burnout. It's just, they're having a bad day, or we're just going, doesn't matter what you think. It's what the employee thinks, okay? It's their thoughts and feelings of their reality. So we need to manage that. And then let's have a look at stigma. Yeah, the big stigma in your organisation. Well, I definitely wouldn't approach EAP or approach mental health first aiders or my manager. Yeah, because this is huge stigma. Then we've got some work to do culturally there in terms of making it okay not to be okay. So that it helps to drive activity in the workplace in terms of changing these thoughts and behaviours. And then to get down to the financial KPIs. Let's just do some really simple stuff. Have a look at your absenteeism rates, okay? How many days lost? What's your absenteeism cost? From those number of days lost, what's your average salary cost per employee? We just took it as an average across the business. Calculate it. You've got your sickness cost there, yeah? Typically, 56% of all worker absence is related to mental ill health, okay? So you can very quickly come up with some indicating numbers, okay? And then you can look at the average tenure. So how long is an employee spending with the company? Because every time somebody comes in, every time somebody goes, you've got leaving costs, you've got onboarding costs, you've got training costs, you've got recruitment agency costs, cost, okay? And how many people do we have on long-term sick? Yeah, for stress-related illnesses. You get somebody going off with a cold, or a broken leg, they'll be back and they'll be working in no time at all. If you have somebody going off with sickness related to stress, generally they're going to be off for 2 weeks. You can probably hazard a guess that might be 2 months. My point is, it's about 4 times longer than a physical illness, okay? They're off for a hell of a lot longer. It's, sorry, can I just, sorry, I think the Amazon man's just turned up. I'll wrap up here because this is the last slide. Just give me 1 second. Sorry. Sorry, I think somebody else has pushed it. Right, sorry. Where was I? So yeah, so we can start to look at measuring this, and we can start to look at measuring these attrition rates and looking at in terms of this average tenure. So if people are leaving in their droves off their own back, i.e. employee-led resignations, what's going on in your organisation? Do we have a really toxic culture here? Do we have a poor onboarding process? Are we just a really bad company to work for? And if its attrition rate is employer-led, what's going on in our recruitment processes? What are we not doing? Why are we bringing in the wrong people? Because we're bringing them in and then we're getting rid of them really quickly. So there are lots of indicators. There's lots of ways to get at data. There's lots of ways to kind of drive the business case for data-driven workplace mental health. And, if I was to tell you, and again, to give you an indication of kind of what this would cost an organization, right? So you're talking, so let's just use a metric that you employ that you train a mental health first aider for 5% of your workforce. So just do that as a rough number, 5% of your workforce. You give every member of staff access to an EAP, and you add the Flourish platform for every member of staff, okay? For an organisation of 50 people, that would probably cost about £75 per employee per year. And for bigger organisations, that would come down to, based on kind of economies of scale, £35 per employee per year, okay? Now you look at that, 35 quid for one person over a year, okay? And then put that into context. For me, it's a no-brainer. You know, one person has to have a couple of hours of off time or one day off that with stress. Do you know what I mean? The potential for the return on investment is huge. Now, I'm not saying, again, I'll go back to the same thing. I'm not saying it's a silver bullet solution. Yeah. I'm not saying it's going to happen overnight. It takes time. Okay. What I am saying is that there is a business case for it. There is an absolute business, you know, the organizations that do this and the organizations that do this well thrive. Okay. You look at the top 50, top 100 companies to work for, they will all have really good stuff in place around this. So for me, it's a no-brainer, an absolute no-brainer. So I was going to stop there and really just ask you if you wanted to unmute yourselves and we can kind of go through some of the chat and just have a quick, I'll answer some quick questions if you've got any.
I can just reflect on that, Sheila. Thank you so much. I think it's so refreshing and really good to see what you guys doing here. Well, I'm working as an organizational well-being consultant, and I can see how some of those tools are very much needed. My approach is very much much more based on measuring and driving individual well-being from neuroscience, from mental health point of view, and providing all of that psychological support. And all of the organizational framework and all of the risk management with that has to be in place for those systems to be effective. So it's really, really good to see that. And I'm really, really glad you're mentioning you know, companies taking those initiatives of, well, even if you can call them initiatives, some yoga classes and, you know, fruit bowl in the office, but actually it doesn't really, you know, address why that person is stressed in the first place, or what are the systems that has to be put in place to support it inside out from very, very holistic point of view. So thank you.
That's it. I mean, it's very much human beings are human beings, so we respond to being treated nicely. It's that simple. And then we like to learn. So if there's somebody like yourself that's doing all of this, where this personal development stuff, all we can do is create fantastic organizations. It's quite simple. Thank you for the feedback. Anybody else?
Yeah, just a quick bit from me, Sheila. I don't work in the same sort of world as you at the moment, although I run a charity which looks after people with PTSD. So we sort of touch bases, you might say. But most of my work in the last sort of 15 years has been based on leadership and management. And I just wanted to pick up on a point that you made, which I thought was so important. They have to be understanding the people downstairs. The leadership talk great games, and I had an experience quite recently in a board and the G-exec team, and this very senior person spoke up and said, "Oh, no, I know exactly how these people feel. They've got no reservations about speaking out at all." And I thought, wow, that's fantastic. I said, "How did you find that out?" "Well, I just asked them." I said, "What did they say?" "They just said, yes, they're fine." I said, "Oh, well, that's it then, it's case proven." You know, and obviously that person had no real concept of how people truly felt, because when I'm doing my leadership and emotional intelligence sessions with them, you get this outpouring of almost grief and huge amounts of stress. And I'm thinking, these guys upstairs can't see this. There's just this complete glass ceiling, you know, it's extraordinary.
Yeah, I was talking to Louise Ayosh yesterday, and she does very keen on kind of this psychological health and safety piece around health and safety professionals. We were doing a podcast, and she was saying, you know, CEOs need to kind of change it from chief exec officer to chief empathy officer. And it's about getting that balance of empathy and compassionate leadership to be able to lead organizations, because the old way, if you will, just purely performance driven and thinking for your minions, doesn't cut the mustard anymore.
I had to laugh.
Brilliant.
Yeah, it's
Right,
interesting.
that.
It's interesting what you say, because in our teaching on the emotional intelligence, we created something called the Moccasin approach. And the Moccasin approach is exactly that. It's from their shoes.
Yeah.
What does it feel like to be me? What stress and pressures am I under on a daily basis? I don't know that if I'm a manager, but I know it if I've got the social awareness to sit and chat with you and really get to grip with that understanding.
Yeah, fantastic. Brilliant. Thanks for that. Thanks, Mac. If anybody else has got anything, speak now or forever hold your peace. Otherwise, what I will do is, one thing I'm going to just plug here, and you'll get it in an email follow-up. I've started a podcast around psychological health and safety. I run that. There's an episode comes out every week. We're about 3 or 4 episodes in. It's relatively new. My co-host on there is Peter Kelly from the UK Health and Safety Executive, who is also a contributing author and psychologist to the ISO 45003 standard. So we've done some interesting interviews with kind of aviation industry, so looking at pilots and mental health. Louise yesterday from IOSH, and we're going to be having people from kind of all different industries guesting on the podcast. Also our partners, our Flourish partners in Australia, run the same podcast. They're about 20 episodes ahead of us. But again, they've got some really good kind of UK guests. So there'll be that UK relevance. So there are lots of global guests, but really, really good source of information from different experts across the field. So if you're into podcasting and kind of following podcasts, really good to kind of plug in. The Australian ones are about an hour long. We make ours about 40 minutes. So just for your information, you've got that there. So Louise, you're just saying you do the Mind Wellbeing Index, yeah? Okay, excellent. Okay, well, it was lovely to meet you all and see faces on cameras. It was nice. Okay, I'm on LinkedIn, so you'll find me just Sheila Lord BMR if you want to connect with me on there. And you know, my LinkedIn profile is full of pretty much the same as this webinar. But the new ISO standard be this month. It'll be out. So be great news, hopefully.